Hi, my name is Samantha Simonetti, and I'm a student physical therapist here at Campbell University. Today I'm going to talk to you about the strain counterstrain technique, and specifically the treatment for the popliteal space, tender point. So the science behind strain counterstrain actually stems from the creator, Lawrence Jones, who specifically looked into the aspects of afferent, aberrant muscle spindles that fire and create a muscle spasm, which then creates a fixation of a joint near those muscles. He found that diagnosing this issue was through palpating tender points in the region. He has found tender points, he has a map of tender points throughout the entire body, but today I'll be talking about the one found in the middle popliteal space, which I've indicated here with this black tape. I will be talking about step by step how to perform the treatment of this technique, as well as show you exactly how to palpate this tender point. So I'll start off by having my patient come over, Phil, and if you could just stand up for a second and I'll show them on the camera where the popliteal space is found. It might not show, so could you actually stand on the table?
Yeah.
So here is the popliteal space. And when I have the patient in the supine position, you won't be able to see the actual popliteal space that I'm palpating during that time, but make sure that you're palpating that area with this technique. So I'll have you go ahead and come down off of the table, and I'll have you lay down on the table. So with this technique, you want the patient in supine position. You want to take at least 1 or 2 towels, roll them up, and put them underneath the calf of the affected limb that you're treating. You're going to make sure that they're in that extended position. So this popliteal space, this tender point that we're treating, is actually known to be in relation to the posterior cruciate ligament. So by creating the force that we're going to create on the femur, we're actually putting the posterior cruciate ligament on slack, and we're allowing it to relax in a way. So make sure that their tibia is in position, in that extended position, and you'll use one hand, one of the examiner hands, make sure it is on the distal femur, allowing you to put force through that. Then you're going to take your other hand and palpate that posterior aspect of the knee, that popliteal space, the middle aspect that I was showing you earlier. Palpate that, and then ask the patient if they're having any tenderness. Do you have any tenderness there?
A little bit.
Okay. So that's indicating that they do have that tender point. Make sure you stay on that tender point throughout the treatment. The other hand on the distal femur, you're going to create that 20 to 50 pounds of force into the table. So what I recommend is make sure that your body mechanics are good enough so that you can just create your body weight on top of the patient. And also make sure that your hand is in a position that you've got a lot of surface area and you're not creating force in one area. So you're palpating, create that force through the femur, and then you also want to create an internal rotation that you'll see with the patients indicated on the foot. So create that internal rotation moment, force through the femur, about 20 to 50 pounds, and palpate that tender point. Hold this position for 90 seconds. While I'm holding this position, I'm actually going to talk a little bit more about the principles behind strain counterstrain. So specifically when you're treating any of these palpable tender points, you want to treat the one that is the most tender, you want to treat the one that's most proximal, and you want to treat, if there's a line of them, the one that is in the middle. If the patient's having several tender points throughout their body, you also want to make sure that you're treating the area that has the most tender points first. If you have a patient that's not capable of telling you that they are in pain because of their condition, make sure that you're not using this technique. This technique is specific for patients that are capable of telling you if they are tender, and also when you reassess, you need them to be able to tell you if it's not as tender. So from this position, I'm going to bring him back, relaxed, and back into the neutral position. I'm going to ask the patient, are you having any pain?
It's better.
Okay. So you want to make sure that the patient is telling you that there is a decline in their pain. If not, you want to reassess how you did the positioning and then once again treat. Now I'm going to tell you a little bit about a patient explanation as to how you can explain to the patient this technique. So Phil, because of the pain that you're having in your knee, I am going to use strain counterstrain. Strain counterstrain is a great technique used when your muscles are spasmed or telling your body that they've got pain. Okay? What it allows us to do is relax those areas and turns them off. Okay? So we're going to use this now, and if it doesn't work, we've got other things that we can do. Okay? Sound good? So one thing that I'm going to talk about a little bit more is the scientific findings of strain counterstrain. I'll show you once more how to do the technique while I explain those scientific findings. So make sure that you're in the supine position, the patient's in the supine position. The examiner is on the affected side. You have one hand that's at the distal end of the femur. The other hand is palpating that popliteal space and palpating that tender point. Make sure that you create that internal rotation moment. Hold the popliteal space. Put 20 to 50 pounds through the distal femur. Hold that for 90 seconds. So the scientific findings I found for strain counterstrain were specifically out of a Wong article where he talked about strain counterstrain and how the pain of the palpated tender points was actually decreased after the use of strain counterstrain. You come back, relax it, ask the patient, are you having any pain in that tender area? Okay, good. And that will be all for today.